There's been some news this morning that, you know, in terms of the lockdown in particular, we could be going to a fuller lockdown by the end of the year. There's a worry that...
Across England.
Across England, yeah. I mean, I know Scotland are already got new restrictions in. Wales, we know, have had a shorter, more stricter lockdown. I mean, is this inevitable? That it's just getting worse, isn't it? And we are in the middle of a second wave, aren't we, at the moment?
Of course we are. And, you know, just look at the figures. The hospitalisations are increasing. They're doubling every 2 weeks. So extrapolate that, a month from now will be worse than we were in the first wave. Just looking at the figures. Unless people are really, really careful and the restrictions up north are kick in and we see an improvement by then, that's what we'll see. We'll see more cases and inevitably, after you see more hospitalisations, you'll see a greater mortality. And we're seeing this across Europe. It's not just the UK. We're seeing this in Sweden, where they relied heavily on herd immunity. That's not happening. They're seeing it in France. They're calling it a brutal rise in the number of cases being diagnosed in France, with 500 deaths yesterday, I believe, over 500 deaths. So it's still very serious. We're still in the pandemic. You know, I'd love to be able to give the population really good news and give them a cause for optimism. But, you know, this is the worst pandemic for over 100 years. We're still there. We can't rely too heavily on a vaccine. We don't know whether that will be effective. We hope it will save people dying, but it probably won't stop infection. Not the early vaccines anyway, but people are working on it around the clock, around the world. And I think we still need to rely on the basic principles, which is, you know, it's hands, face, space. And if we all do that, and we're realistic and we don't say, you know, but Christmas is an exception, because if we make Christmas an exception, unfortunately, every little celebration will be an exception. A birthday will be an exception. A Friday night will be an exception. A promotion will be an exception. And if you keep making exceptions to the rules, that's how the pandemic spreads. And that's the reality of it.
But there is some relative good news, and I say relative carefully because it's about the number of people who get into intensive care now from COVID and the death rate from that apparently there are fewer people dying once they are in intensive care, which is, you know, it's not exactly hopeful, but in that sense, and that's down to treatment, doctors knowing much more about what to do at what stage of the infection in a person's body.
Yes, we've learnt more about the virus. There's still more to learn, but we know that rather than put people on ventilators straight away, oxygen therapy is the key thing. Give people oxygen with machines which are less invasive than ventilators is the way forward, seems to be saving lives. And yes, the mortality in people in ITU and in critical care isn't as bad as it was in the first wave. However, we're seeing a younger population in those beds. So why is that? Well, partly because the people who are most vulnerable are shielding better. They're being much more careful. But we're seeing a larger number of younger patients, which is of concern in itself. We've also got better facilities. We've got more space to put people in COVID beds. But we've still got limited numbers of staff, and that's going to be the critical factor. You can have as many beds, as much space as you want, and many operating theatres have been taken over that would be normally used for routine operations to treat COVID patients. But you've only got a finite number of staff, whether you're looking at patients in Nightingale hospitals or in ordinary hospitals, COVID hospitals. You've only got limited numbers of staff, and we have to remember the sacrifice the NHS made in the first wave. We can't take that for granted forever. We have to protect them. It's still really critical that we protect NHS staff and facilities and make sure that we look after people with heart disease and cancer as well. And it's a huge task. And if we have a seasonal flu, which isn't likely at the moment, looking at what's happening in the Southern Hemisphere, we're not likely to get that double whammy as well. However, there's certainly no room for complacency and everybody has to be really careful.
So we're just talking about, obviously, Christmas and what's going to happen and whether we're going to be in Tier 3 by then. And the curiosity, and it's only because actually quite a few of you have texted and emailed in this morning about the rule of 6, saying that if children were exempt, at least for Christmas, under 12, then it would release some of the tension around whether you're breaking the rules. Do you see what I mean, Hilary? And
yeah,
the curiosity is why children are included in the rule of six in England, but not in other places.
Yeah, I mean, it's one of the problems, isn't it? That the different the different countries have got different rules, and it's very confusing. And what we desperately need is a rule for every country leading up to Christmas. Otherwise, it's going to be mass confusion. People not knowing whether they can travel, whether they can stay overnight, whether they can have more than 6 if it's just children. The rule of 6 was intended to simplify everything. Rule of 6, keep it to 6, indoors, outdoors, depending which tier you're in. So it does get very complicated. But, you know,
if you've got 3 kids at Christmas, then you can't have any grandparents there because basically there's 5 of you. And which one are you going to choose?
Simple fact is that the more households that mingle, the greater your transmission of the virus and the greater number of cases you're going to get.
Okay.
So, you know, my view is that of Sage and Sir Patrick Vallance, that, you know, we have to be really careful leading up to Christmas, because, you know, if we prefer Christmas partying, whether it's a religious ceremony or not, if you prefer that over the health of the nation, you're going to be in the same problem as we are now into spring and summer of next year.